शांतं पद्मासनस्थं शशिधरमुकुटं पंचवक्त्रं त्रिनेत्रं शूलं वज्रं च खड्गं परशुमभैरं दक्षिणाङ्गे वहान्तं नागं पाशं च घण्टां डमरुकसहितां चाङ्कुशं वामभागे नानालङ्कारदीप्तं स्फटिकमणिनिभं पार्वतीशं नमामि. In this video, I wish to point out certain aspects of autism. In a specific case I have studied, I found the autistic child born in the IVF process. I could attribute some of the aspects to the process difference between a natural procreation process and this IVF process. In the natural process the male sperm makes a strike at the female ovary, whatever the other method, other aspect, other female thing. Here it is not striking, but they take it and mix it. What they do, I don't know. But this strike or impact aspect is not there, and as such there is a positive specific difference, impact difference in the process. There is a process difference between the two. And another important aspect is here, in the previous generation and our generations, the current generations, whether it is IVF or whatever method, the onus is more on here the people, they have gone for taste oriented food rather than wholesome nutrition oriented food, because their preoccupation of some people with taste is they give so much importance to the taste aspect of the food that in the semen formation process, the semen has ultimately it is the food that makes the thing. In this case, this taste dominated case, the semen lacks wholesomeness, and correspondingly the formation of the child takes place. So the here important very aspect is prevention is far better than any cure. The best method to in cases where if this could be the positive cause for autism of the child, best thing is those who go for IVF, for anybody going for procreation, they should go for wholesome food rather than tasty food, because it is the food that makes the life creating semen of the male. I'm talking of the male aspect, and the other is impact of in the process, in the natural coital process, the male sperm hits with a bang and it is a strike, which is not the case, I think, in the IVF process. So this is the basic difference I wish to point out in this medical video I am making. And other aspects are electrotherapy for dementia. In a specific case I had studied, the lady of the gentleman, she told me, I didn't know much about dementia. She said the brain size becomes smaller. That means there is a gap between the skull and the brain increases. That means intercranial pressure decreases. For this, what we have been doing for a long while here in Hyderabad, M.K. Shastri, the acupuncture specialist in Madhapur, Hyderabad, and other Dr. Chandrakant and his trained person, physiotherapist Dr. Bhaskar, they have been doing a few needles at in the and electro gadget in the hand. So it is a neuroelectrotherapy for the process. If there is a pressure decrease, electrical voltage is a pressure between the positive and the negative neutrals, electrodes. So the very electrical terminology says electric volts is pressure. So if we give the reduced pressure in the cranial pressure has come down because of the reduction of the size of the brain. If we give externally through electrodes and this neuroelectrode combination, acupuncture combination, we can increase the pressure, and some of the faculties which have been lost in the process by diminishing of the size of the brain might be recovered. This is my hypothesis, which Dr. M.K. Shastri of Madhapur, he said is a good hypothesis. We need to experiment further on this. This experimenting I leave it to the people who are in the field. This is the dementia aspect, and as it is the sperm quality that makes the child. So the superior the sperm quality is, the better the child is. Really, so we have to tell the younger generation that refrain from, at least for the duration you are in the process, refrain from taste oriented, or switch over, or give priority to wholesome nutritious food rather than taste oriented. But in one case, the girl was telling, "Daddy, watchman children are normal." I said, the watchman doesn't eat the apple with the skin taken out, or the badam with the skin taken out. They eat it complete. In very childhood classes we have studied, most of the vitamin contents are in the skin of the outer layer, and that you are taking out, you are losing the nutrition value. So similarly here, the onus should be more on the wholesomeness and nutritious value of the food, and that will go a long way in making a high quality sperm and correspondingly a normal child. And regarding some people, those who are for long times in the hospitals ceilings, seeing for a long time, for them I suggest a karma correction, a long term karma correction. It is not a small period, small thing, but those who are bedridden for a long time in the hospitals, if their people, they do some on their behalf, they do some karma correction. This means some, see, in the sapatra dhanam, it is called in Sanskrit, that is donation to the deserving people, writing a simple check and giving it to the professional recipients. Some of them, they do good service also, but sometimes choosing a very deserving candidate is a very difficult aspect in donation, and genuine receptors are to be distinguished from the fakes. This is a difficult aspect, but over a long period, when it is done, this adds to the, like a pawn moving forward with no opposition. One time at the end of it becomes a minister or queen. Similarly, this karma correction helps those bedridden for a long time in their aspect, in the health aspect, and they can come out of the hospital ceilings and see the sky one day or other, and more sooner than they would have otherwise done. So this karma correction is an important aspect I want to add. And this medicine for autism, that is, one is automoxetrine or Oxpecta, the commercial name, is a reuptake inhibitor and attention deficiency improving, ADHD. So here, from the because of the side effects and very what you call pressurous type of medicine, a lighter aspect I am suggesting. When I had a tooth for a long time, I didn't have, when I had a whole set of my teeth troubling, I called my dentist from Hyderabad, Visakhapatnam dentist, Dr. Vinod Mansukhani. He said it is due to some infection. I am suggesting one Powergesic, one tablet that will stop your pain too. I said, how does it work? He said, he stops the signal, pain signal from your jaws to the brain. So this is also inhibitor or stopper or whatever it is. If the automazine hydrochloride, in that, if that is very powerful, this Powergesic inhibitor, if that could be combined for a lower level of strength, which could be more easier for the patients to take in. This is my suggestion. I don't know much about it, but this is a suggestion that I could easily tolerate. Similarly, people who are knowing about this aspect, but they are very fearing about taking it. For them, this will come down, and this combination of another inhibitor, whether they will combine or not, I do not know, but this is a suggestion they could try out. And another thing, this in the same video I want to say anti-aging. My method of anti-aging is learning process nullifies the aging process. My thesis is, when the mind is engaged in the study of a topic which it finds it difficult to understand, at the same time interesting, it feels younger. The person feels younger. Due to the challenge state, and the underlying hypothesis is, due to the challenge state gland secretions that take place, the person feels younger. Challenge state is a different state from normal state. The person feels younger. This idea struck me when I was studying non-control theory, non-linear control theory in control systems in electrical engineering in my 4th year or final year. That time the book was McGraw-Hill publication, Gibson and Tudor. Normally I used to consider myself a fairly intelligent person, but when I came here, after reach this point, I was feeling difficult to understand, and I was feeling, is my IQ failing, or the topic is really beyond my domain, my IQ level. But then that is the time it struck me that this struggle of understanding a thing was giving me results in physical aspect somewhere else. That is, I was good in sprint at college. Normally I used to third, second, but that year I stood first in my college sports. I didn't do any extra practice, but those very days I was struggling through to understand this nonlinear control theory. This academic struggle was reflecting on physical aspect of my results in the sports field. So this anti-aging best thing is, if you want to look more beautiful, this aspect of going younger is best thing is study something which is difficult to understand, at the same time interesting. That will reflect on your youth. You will go down. I studied, and I used in my competing with the boys who were younger than me by 10 years, and I came out quite successful. So this aspect is very enchanting, and is a forever youth formula. You can always, and it is not always physical process, and sometimes the solutions are so simple we overshoot them. Because when I suggested this electrotherapy even for Parkinson's, people were saying, no, there is a very complex thing, and for nullifying this epilepsy also, because we were getting epilepsy strokes are related to our lunar cycle. The sea waves are connected to lunar cycle. Similarly, our body sex behaviors and all the mental behaviors are related to the lunar cycle, and over a period what happens, we can know that when a person is regularly getting epilepsy tricks, so his next timing we know, and the epicenter formation of that seizure for center we can nullify by giving electrotherapy signals, and if it is done calculatedly, that gets cancelled, and epilepsy strokes gets nullified. So if we do over a period a few times, what happens? the brain machine has learnt, will have learnt sufficient to forget this aspect. So that is one aspect in the electrotherapy. Sometimes people they presume the things are very, because as we know, most beautiful, most greatest all-time heroine Scarlett O'Hara was not beautiful, but men seldom realized it when caught by her charm, as the Dalton twins were. Similarly, sometimes the solutions are simple, we overshoot them, and simply presume that it is very difficult to obtain the results, or presuming that we avoid the very attempting to make a solution, try for a solution. So avoiding those aspects and those things, we can go for some simple tries for simple solutions, and we might get good results out of the whole process.